Hi, my name is Jaceyphillips, and I'm going to be talking about the implementation of collaborative practice on the unit. I've decided to choose this topic as I did my NURS 401 on a unit where they worked very individually, and it was very difficult for nursing students and other staff members to understand what was going on. So I'm going to implement a collaborative practice on that unit. So, why collaborative practice? So, collaborative practice improves patient safety and produces more favorable outcomes. It's essential for nursing care in the inpatient setting. When they work together, patient needs are met more efficiently, services are more coordinated, and continuity of care is maintained. It also fosters open communication, respect, and shared decision making. So it helps reduce errors, promotes patient-centered care, and helps provide more support for staff members through that collaborative work environment. It also ensures that if there is an adverse patient event, that a cohesive response can be implemented. So diverse perspectives and voices must also be acknowledged. So we're going to get some external nurses who already work with collaborative care to help nurses on the unit transition. So they're going to be enthusiastic, they're going to advocate for the change, and they're just going to provide some insights and feedback and their own experiences to help nurses on the unit accept this change more. We're also going to collect patient and family feedback on the care team progress. So this is going to be especially important in determining if their timeliness is improved, patient-centered care is improved, and what areas they need to continue to work on so that we can continue to support staff members and improve practice. It's also going to be important to have culturally sensitive spaces in an environment that's safe to share their feelings, frustrations, experiences, or maybe some input they might have to implementing this collaborative care approach on their unit. So, in order to implement, we're going to have that mandatory education. We're going to implement Alberta Health Services COAC care model, which is further going to be subdivided into role clarification, the creation of care hubs, and a more active involvement from the chargers. So, first, we're going to have some mandatory education, which is either going to be done through in-services on the unit, where groups of people come around and talk to staff members, or through a special training day that's been adapted that all members of the team will eventually attend before it's implemented on the unit. So during these training days, the COAC care model will be introduced. Collaborative care will be introduced. So by the end of the day, team members will understand what their individual role is, what their role within the group is, how it's going to be implemented on the unit, and what specific changes they're going to see and how they're going to carry out these changes. They're going to learn how to work cohesively as a team. And these training days are going to be a safe place to address any uncertainties, questions, voice opinions, share experiences. So nurses are going to be able to be open and honest and have communication there. So within the first part of the COAC care model, we're going to do role clarification. So the care hub team members will understand the importance of introducing themselves to their patients and who they're caring for. The team members will also give the nursing students, new staff members, an opportunity to introduce themselves, explain exactly what they're there to do, what their role is, what their scope is. The nurses, especially, so the team lead and the buddy nurse will explain to them what patients they have, what they're there to do, any practice restrictions they might have. They're also going to introduce themselves to their patients, so their patients are going to know who their nurses are, who their healthcare aides are, who their doctors are, so that if they have any questions, they know who they can go to. This will help student nurses, new staff members, patients feel more included. So the COAC approach is a model that helps provide collaborative care practice on the unit. So this role clarification is just step one. So step two is the creation of care hubs. So within the COAC care model, the care hubs will include a registered nurse, a licensed practical nurse, and a healthcare aide. The care hubs will do handover report together, so all members are aware of patient complexities, any patient who's unstable, who's a fall risk, who needs help, and they're able to assist if critical situations arise. They're going to do their initial rounds together. They're going to introduce themselves to their patients, put their names on the whiteboard, make sure everybody's safe, that the safety equipment in the room is set up, and that's going to be done at the start of the shift. And then throughout the shift, they're going to check in with each other, make sure that their patient loads are manageable, they're feeling supported, and that if there's any concerns, they're addressed right away. So the third aspect of the co-ed care model is increased charge nurse duties. So charge nurses are going to assign patients to the care hubs. They're also going to assign the nurses to the care hubs in a way that fits the assigned skill levels of the nurses and understands patient complexities so that one group isn't having multiple complexities and the other isn't. It's going to be evenly spaced around the unit. The charge nurse is going to become more active in patient decisions. They're going to attend bed huddle, report back to the floor nurses what happened in that huddle with any discharge barriers or anything that they need to work on. And they're going to ensure that the staff members are feeling supported and that they're following a collaborative care approach on the unit. So in order to implement collaborative care on the unit, we're going to have to use Havelock's 1973 change theory. So this theory focuses on a systemic relationship-focused approach to change, and it consists of 6 steps. So building a relationship, diagnosing the problem, acquiring the resources for change, selecting a pathway for the solution, establishing and accepting the change, and maintenance and separation. So further, it can be subdivided into unfreezing, change, and refreezing stages that were adapted from Lewin's theory. So the first stage is the unfreezing stage. We're going to build relationships and diagnose the problem. So we know the problem is that they're working individually and that patient needs are not being met. So in order to address this change, we're going to build relationships with the staff, make sure that they feel supported, that they know that there's someone there for them that cares about them and that will help them through this change. The second step is the change initiative. So we're going to acquire resources for the change. We're going to bring in those external nurses to help advocate and provide enthusiasm for the change. We're going to have the mandatory education so that nursing staff and other members of the interdisciplinary team will understand what's going on, what's changing, and how it's going to change. And then we're also going to select that pathway for solution. So that's going to be our co-ed care model, which is what we just discussed through role clarification, the creation of the care hubs, and a more active involvement from the charge nurse. The last stage is the refreezing stage, so it's further going to be divided into establishing and accepting the change. So we're going to be monitoring staff responses, feedback. We're going to make sure that the staff members know that we are going to value their feedback. We're going to take it in and make sure that we're providing support for them. And then maintenance and separation. So we're going to make sure that they're following this approach by conducting patient and family feedback to ensure that all needs are being met in a timely and efficient manner. And we're also going to be making sure that staff members feel supported and that we're going to make an effort to adapt the approach if more education is needed. So in order to implement this, we're going to need to have a transformational leader. So this leader is going to work very well for this as they are going to focus on motivation, empowering others, and advocation. So staff members will feel motivated during the change. They're going to want to accept the change, and this leader is going to educate them on why it's important that has an environment that is supportive and inclusive and understands all different perspectives of it and will help team members accept it. They're also going to go around on the unit and make sure that if there's any questions or uncertainties, that questions are being answered. They're going to be a mentor for the charge nurse if they're having trouble creating care hubs or assigning different nurses to the areas that they are in. And they're going to make sure that all members of the team's well-being is considered, especially in their physical, emotional, and mental health, as that will be essential if the change is accepted on the unit. Because if staff are feeling unsupported, undervalued, or forced into this, they're not going to accept the change. So it's going to be important for the transformational leader to be motivational, empowering, and advocating for change. And I believe that this type of leader is essential for the change that needs to happen. So in conclusion, collaborative practice will be a meaningful and positive change to the unit by introducing mandatory education and integrating Alberta Health Services co-ed approach. I believe believe we can enhance the quality of patient care and foster more favorable outcomes. So thank you for listening. I just have my references on the following pages. Otherwise, I hope this will work and collaborative practice will be implemented. Thank you so much.